Hi, my name is Dr. Joshua Beckman, and I am the chair of the PVD Council for the American Heart Association. One of the new features of scientific sessions in recent years has been the Frontiers in Science program. And today I'd like to discuss with Dr. Steve Lentz, who's on my left, one of the really interesting programs today that the ATVB Council is putting on. Dr. Lentz, can you tell us about your Frontiers in Science session?
Sure. So my name is Steve Lentz. I'm the chair of the ATVB Council, and we're very excited about an innovative new session which will be held tomorrow, Monday, and it's a full day focusing on frontiers in thrombosis. It's a very exciting time for thrombosis, partly because we now have several new anticoagulant drugs into the clinic for a variety of different indications, venous thrombosis, arterial disease, and stroke as well. And so we thought it would be a perfect time to bring people together. And so the focus of this session is bridging basic and clinical sciences in thrombosis. So we're going to have a session in the morning on venous thrombosis. We're going to have a session on platelets and antiplatelet therapies. And we're going to have a very interesting session that we call the Holy Grail of anticoagulation. So in thrombosis and in anticoagulation, as you know, for years we've been trying to find the drug that can prevent thrombosis without causing bleeding. And maybe we're getting closer, but we're not quite there. But there are some very exciting basic science discoveries focusing on drugs that target the contact pathway of coagulation, which will be coming into the clinic soon. So we thought it would be a perfect time to bring basic scientists and clinicians interested in thrombosis together. The programming for this Frontiers in Thrombosis session was put together by programming committees from both councils, from ATVB and PVD. And then the centerpiece of the council of the session at 2 o'clock will be the Saul Sherry Lecture in Thrombosis, which will be given by Dr. John Griffin from the Scripps Institute in San Diego, in La Jolla. And Dr. Griffin is the perfect speaker for this session because he's a basic scientist, but he's a basic scientist who's always been interested in clinical application and translation. And Dr. Griffin will be talking about his work on activated protein C, its antithrombotic and anti-inflammatory mechanisms as it relates to stroke therapy. So we're really excited about this session. We welcome everybody to come tomorrow. Starts at 9 o'clock, Monday morning, room 217.
Well, I have to say, I think it's an incredibly exciting thing. We're going to be having conversations that span the wide range of researchers in our field, everything from the most basic to basically population science and everything in between. I hope to see you there tomorrow.
And I think you want to tell us about another Frontiers in Science session that will be held tomorrow, focusing on peripheral vascular disease.
So the Peripheral Vascular Disease Council is having a special session at 2 p.m. tomorrow afternoon. Our session is focusing on the unmet needs in vascular disease, and there are two really important ones that need to be filled and people who are leading the field there. The first focus is going to be on the epidemiology of peripheral vascular disease. It's hard to study a problem when you don't really know how many people have the problem, and whether we're talking about aneurysmal disease, venous thromboembolism, or peripheral artery disease, the numbers that we work from now are terrible. So I think folks who are leading efforts to try and figure out what the true epidemiology is are those who are leading our field. The second area that we are interested in is improving animal models so that once we have an idea either from the bed or arising from more basic models, we can test our hypotheses in animal models before we bring them to the clinic. I agree with you that these sessions are just an incredible way for an interaction between those leading the field and those who want to join the field. They are short sessions that last about 6 minutes each per talk, and I will say that the presentations are informative, and then there is a casual conversation that can occur afterwards between the members of the audience and the experts that we bring up.
So you can learn a lot real fast, and then have time to network and build on that, develop collaborations and so on.
Exactly right. So the conversation will participate in moving the field forward and moving you into the field if you want to get there. And then I think you know exactly whom to contact in case you want to start to do research in that area. I think the collaboration between ATVB and PVD is essential for moving forward our understanding of vascular disease, basically in all of its aspects. And so it's a pleasure for me to work with Steve on these projects to move things forward. I think we are a pretty good example for the American Heart Association as to how science should be done collaboratively and move forward together.
I agree completely. I think this is the way of the future. As you know, we're working together on the spring ATVB PVD meeting, and I'll plug that. It'll be held in Minneapolis in May of 2017. We're really building on that. We're extending the programming into the scientific sessions, and I think this is what we need to do more of moving forward.
Totally agree. Thanks very much for listening to us, and we hope to see you tomorrow.